Back to the motion. Madam Speaker, I wish to move the following motion: that aware that according to the National Protocol for Treatment of Substance Use Disorders in Kenya by the Ministry of Health, drug abuse has been increasing in Kenya, especially among the youth, with statistics indicating that more than half of drug users are aged between 10 and 19 years. Further aware that research released by the National Authority for the Campaign Against Drug Abuse, NACADA, in December 2022, placed Western Region as the leading region in alcohol and substance abuse at 23.8%, followed by the Coast Region at 13.9%, and the Central Region at 11.9%. Recognizing that the high level of drug abuse in the Western Region is attributable to illegal entry points from neighboring countries and unlicensed establishments, especially in Bungoma and Busia counties, with statistics indicating that 2 out of every 5 establishments in Bungoma operate illegally. Further recognizing that a majority of the consumers of illegal substances are school-going children who end up dropping out of school, cognizant of the fact that the Alcoholic Drinks Control Act 2010 established the Alcoholic Drinks Control Fund, whose purpose is to, among other things, facilitate the dissemination of information on alcoholic drinks and promote rehabilitation programs in the country. This House urges the government to institute intensive programs for the dissemination of information on alcohol and substance abuse in line with the Alcoholic Drinks Control Act 2010 and to increase the number of rehabilitation centers across the countries. Madam Speaker, we are staring at a problem of magnificent proportions. The recent report released by NACADA indicates that there are increased cases of drug and substance abuse in this particular country. I am aware, Madam Speaker, that under Schedule 4 of the Constitution of Kenya, the issue of control of drugs is left for the county governments. But there is no part of this particular country that is not a county. Therefore, we need to take up this particular problem and address it. The statistics that were released by NACADA in December 2022 are very shocking. It says that 1 out of every 11 youths aged between 15 to 24 years were currently using at least one drug or substance of abuse. It also says that 1 in every 5 youths aged between 25 to 35 years were currently using at least one drug of substance abuse. It also says that 1 in every 3 Kenyans aged between 13 to 65 years, translating to a population of 8 million people, had minimal depressive disorders. Drug and substance abuse, Madam Speaker, has wrecked families. Children have been left destitute owing to consumption of drugs, specifically alcohol, cocaine, cannabis sativa, and heroin. And Madam Speaker, unless and until this problem is addressed, we are staring at a very bleak future. Jobs have been lost because of excessive consumption of drugs. Children, in the survey that was carried out by 2 commissions into cases of school unrest, drug and alcohol consumption was singled out as some of the causes that were causing consumption or causing unrest in our schools. Teams who have a mental health disease who need to actually be attended to. If we look at the statistics of rehabilitation centers in this particular country, Madam Speaker, we find that only 5 rehabilitation centers are run by the government of Kenya. 90% of the rehabilitation centers are run by faith-based organizations and other private entities. It is the role of government by creation of NACADA, which has been given a role to carry dissemination of information, to carry sensitization, advocacy, to ensure that not almost half of our population is imbibing drugs. And this problem is getting worse, Madam Speaker, owing to digitization. Right now we are finding youths, underage children, are buying these drugs through online platforms. We have not been able to control online platforms. The county governments were given a role of putting up control of setting up mechanisms to control licensing. But most of the county governments, I wish to state that they have failed because their main obsession is licensing outlets where these drugs are sold. And because of their main concern is revenue collection. You will find in most urban centers, wines and spirit shops littered everywhere, where this alcohol is being sold across the counter to even very, very young people. We need to move from this hammer-tongue approach, where the national government at the county level is only concerned about arresting these people and taking them to courts and treating them as victims or criminals. We need to begin taking this as a mental issue and look at it as a mental disease which we need to take care of. How do we take this as a mental disease? There are people who have, if you move in the streets, let's say in Bungoma, you'll find young boys sniffing glue. These people create street families. With time, they mutate, they become criminals. But we are not focusing on treating these people. The only way we can be able to treat these people is to establish rehabilitation centers. These rehabilitation centers, we can ring-fence all the funds that are collected from licensing of these outlets that sell alcohol and drugs. Ring-fence all those funds that are used for licensing and direct them towards running of these rehabilitation centers. Because I think in each of all our constituencies, we will find families that have been wrecked by alcohol consumption, by drug use, consumption of cannabis sativa. You arrest these people, we take them to courts. Yes, we find them, but we release them back to society. They go back to the same habits they were with. So, Madam Speaker, I was moving that this House urges the government of the Republic of Kenya to ensure that we put up rehabilitation centers almost in each and every part of the county, so that these people who are now addicted to drug and substance use can be treated as patients. Sufficient funds can be put there. People can be capacity built so that they are actually treated. We treat this as an ailment, not as a criminal offense which you arrest people and take them to court and have them fined, then they return back to their normal circumstances. Equally, Madam Speaker, we created an organization known as NACADA. This was supposed to do sensitization, run rehabilitation centers. NACADA is not being adequately funded to be able to run its programs, specifically in civic education, outreach programs. When I visited their offices, they are only running one rehabilitation center in Meritini in Mombasa. But even then, they have challenges. What are the challenges they're having? They're having the challenges of funding. They're having challenges of staff. They're having challenges of, keeping the patients there. So we need to facilitate this organization so that they can be able to perform its statutory mandate as given up in the enabling statute that actually creates them. We believe, Madam Speaker, that we need to move from treating these people who are suffering from substance abuse. Some of them have lost jobs. Some of them families have been left destitute. Some of them have even died. So that we will do a paradigm shift so that we treat them as mental patients who require actual treatment and not punishment. Madam Speaker, with those remarks, I beg to move and request the Honorable Dorothy Kiara to second this particular motion.